palpating structures from behind the patient. And so you need to make sure that you start by giving your instructions while you're facing the patient. And then you'll see that I will put my hand on the patient as I pass her and then keep my hand as I go around. Okay? So Liz, what I would like to do is locate some structures on your shoulder blade and see how they are working one compared to the other so that we can try to figure out what's going on with your shoulder. Is that okay? Okay. So I'm going to start over on this side. Okay. So now the easiest border to find here is going to be the medial border, and that's just the length of the scapula medially. Sorry, Kevin.
Oh, that's right.
I'm notorious for not making it easy to use muscles. So there are going to be a lot of muscles that attach to the medial border, and what would those be? Have you learned those?
Rhomboids.
Okay. So rhomboids are going to be attaching up on the superior aspect of the medial border. What else?
Part of the levator scapula.
So levator scapula is going to be right at the superior angle, and we'll talk about that's a very key point to palpate. That's on our list. We're also going to have middle trap, upper trap, middle trap, and lower trap all along that medial border as well. So actually, very little will happen to the scapula as far as the medial border. There isn't any pathology that involves the bone of the scapula, but rather why we palpate the medial border is because we care about all of those muscle attachments. So we're really palpating just medial to the scapula, and we're feeling for any kind of tissue texture abnormalities in the muscles. Are there any muscles that are really tight? Is there an asymmetry here? We're also looking at the scapula as it rests. Now, I know it's safe for me to guess in this class that Liz is right-handed. So we're looking at her scapula, and are they sitting on her thorax equally? Now, I would never typically palpate from the behind at the side like this. I would want her on a chair, and I would want to be directly behind her. I'm trying to maximize you being able to see her. But otherwise, I would want to be behind. Okay? So we talked about the medial border. You can come down, and then we have the inferior angle. Okay? And then you can come up along the lateral border. And this is going to be a little bit easier in prone. So you're going to follow that lateral border on up. Okay. The spine of the scapula is going to be what divides, what is above and below the spine of the scapula.
Supra and infraspinatus.
So the fossa for the supra and infraspinatus. Okay. So to find the spine, it's best just to put your hand on it and the spine will jump out at you. So then you can palpate the infraspinatus fossa and the supraspinatus fossa. Okay. Now clearly those muscles are sitting in the fossae, so you're not actually palpating, again, the bones themselves, but rather the muscle bellies. Okay. So we've got spine, medial border, superior angle. We talked about the levator scapulae, so that's going to be right at the top of the medial border. That's the attachment for the levator scapulae. That's a muscle that's commonly implicated with people with cervical problems. And so that's a good place to look for tissue texture abnormalities and tightness, and you might want to follow that up. You do carry tension in your shoulders. Professor Boyd was correct. We talked about the lateral border, and then we talked about the fossae. So the last one is the first rib. Do any of you remember Leave It to Beaver? Have you ever seen June Cleaver images? So if you can imagine that tight pearl necklace that June Cleaver would wear, that's where your first rib is. So your first rib is, if we pretended that I was going to strangle you, which I would never do, that first rib is that tight. Okay? So in sitting, and you will find, I'm not totally confident that I'll find it in Liz because her upper trap is so tight. It'll be a little bit easier to find in people when they're supine because their muscles will be a little bit better relaxed. We're going to come in at a 45-degree angle between the scalenes, and we're going to hit on that first rib. But again, it's going to be right at the base of the neck because that first rib really sits right there. It's not wide like the rest of our ribs. So I'm going to come in here. Oh, and it is. I can find it easily on her left. I'm not finding it quite so easily. Now remember, we're feeling a bone, so you should know that it's not going to have a lot of spring to it. Okay, now just by shifting to talk to you, I'm not on it anymore because that's squishy end feel. Versus when I was here, I was on the bone. Okay? So, the structures, medial border, inferior angle, superior angle, lateral border, infraspinatus fossa, supraspinatus fossa, first rib.